To all of you. I welcome you all to the civics class. We are in the second chapter, that is role of government in health. Till now we had known the main concept of this particular chapter. We have understood what is health. We have also gone through the role of government to adequate a proper health care facility. And also we have known the difference between the public and private healthcare facility. Yesterday we had covered up about the private healthcare facility, that how private healthcare facilities are available in our country, and in a large number of private healthcare facilities are there. But basically they are in the urban areas because their main motive is to gain profit. Public healthcare facilities are run by the government, but the private healthcare facilities are run by an organization, individual, or a company. And their main motive is to gain more and more profit. There are also doctors who had established or run their own clinics. And there are also laboratories, nursing homes, medical shops in our nation. But the difference is that in private healthcare facilities, everything is there, okay? First class treatment is available there, but it's too expensive compared to the government. So all the people can't afford it. So from here what we came to know, that healthcare facilities are not available for all the people of our country. The proper or adequate healthcare facilities are not available for all the people. In India, private sectors are increasing. Government sectors, hospitals are also increasing. Every year 15,000 doctors, you can say, come out, okay, and there are number of hospitals established by the government, and every year it's just increasing. But the quality of treatment, is it increasing? No, isn't it? The quality of treatment in a government hospital is not like the treatment in private hospital. In private hospital, when we have known the story of Ranjan and Aman, we have clearly known the circumstances, how the environment is in private hospital and in government hospital. But the cost is very high, medicines are very expensive in private hospitals, and private hospitals are also located in urban areas because their main motive is to gain profit, and in rural areas they will not gain that much of profit, isn't it? Because in rural areas the number of population is also less compared to urban areas, and also the people can't afford the high class facilities provided by the private hospital because it's too expensive and costly. Due to this, many poor people can't afford, you can say, the facility, okay, the facility of private hospitals, and they had to borrow money when there is an illness in the family, because government hospitals are not at all successful to provide the quality, okay, the quality of treatment that private hospitals are providing. So obviously every individual required a good and best treatment for him or her. So if government hospitals are not providing the quality of treatment, then they have to move towards the private hospital. But the expense is also very much in private hospital. It is too costly. So they can't afford it. The poorer section of the people can't afford it. But they doesn't have any option also. So they had to borrow money, okay, from their relatives, from their friends, or else they had to sell their property or their belongings for proper treatment in a private hospital. Private service encountered incorrect practice also in order to earn more and more money, because their main motive is to earn more and more money only. Prescribing expensive medicines, injections or saline even when it is not necessary. the private hospitals do this kind of things in order to earn more and more profit. But still, people are going to private healthcare centers. Why? Because they are providing the best treatment. It's hygienic, it's full of all the comfort, whatever a patient required in a hospital to be fit. Then healthcare and equality. This is the question, isn't it, for today's session. Is adequate healthcare available to all? So the answer is a big no. Now you have understood these circumstances or the perspective why the answer is no. Because there is a huge difference, okay, in the quality of treatment in private and public healthcare services. In fact, all the people can't afford also the private healthcare services. But in order to, you can say, be fit and to get a proper treatment, they had to borrow money from others in order to be admitted in a private hospital. We had also known the story of Hakim Sheikh. There are also such kind of problems in government hospitals. He was not admitted. Why? Because the government hospitals are saying that they doesn't have any kind of space, okay, in their hospitals. So at last Hakim Sheikh was admitted to a private hospital. Do you think Hakim Sheikh had, you can say, spent lots of money in private hospital? He has that economic state or status? No, right? Obviously he had you can say borrowed money from someone for his treatment in a private hospital. That is why he filed a case. And you can say the court has also ordered the government of that particular state to give the expense whatever he had spent in his treatment. Because it's the duty of the government to provide adequate healthcare facilities to each and every citizen of our nation. But they are lacking behind. That is the reason why all the people are not getting the proper healthcare facilities in India. Adequate healthcare facilities are not available for all the section of the people in our country. Fact and figures which shows that problems in healthcare facilities are: number one, only 20% of the population can afford the medicines that they require during an illness, because medicines are too costly, and for a middle class people, that means people belonging to a middle class family, it is really hard for him or her to buy the medicines which are too costly. So only 20% of our population can afford the price of the medicines, which are, you can say, increasing day by day. 40% of the people who are admitted to a hospital for some kind of illness or injury, they had to borrow money or take money for someone. Even they have to sell their possessions or their belongings in order to pay the bills of their treatment, their process of treatment. So there are also some pictures, you can go through it on your screen, that how costly is the price of the medicine, how people have to, you can say, take loan from the banks also for their treatment, and by keeping mortgage of their property. Also in some situations they had to borrow money from their relatives and friends. So these are some of the challenges for which every people are not getting adequate healthcare facilities in our country. Now just look into the screen. This is a cycle, okay, which I have tried to show you all. So poor and illness have a connection with each other. How? Just recall the story of Kanta. Her daughter falls sick because of the environment where they are living. So poor and illness have a connection. As a result, they have to spend lots of money in their treatment and they become more and more poor. and suffered from poverty. There are also not, you can say, basic amenities in their society, in the environment where they are living. They doesn't have proper food or adequate food to eat, and they remain undernourished. They even doesn't have clean drinking water in their locality. So they are more likely to fall ill. Many times women health is neglect. Here we can clearly see a gender inequality, because women's health concerns are considered to be less important than the health of man in the family. In the rural areas, this is the most, because women are not the bread earner of the family. They are involved in household activities, and the men are, on the other hand, they are the bread earner of the family. If something happen to them, who will look into the family? So men are given more importance than the women. Also, there are some other problems, like problems in tribal area. In tribal area, there are few health centers, and even they are not run properly. Private health services are not available in the tribal areas. As a result, the tribal people suffered a lot of problems or difficulties. What can be done now? In order to solve this problem, what a country could do? Health situation of most people in our country is not good at all. But it should be the responsibility or duty of the government to provide quality healthcare services to all its citizens. But they are lacking behind. That's why this problem is arising in our society. We are knowing this from the beginning of this chapter only, that the sole duty of the government is to provide adequate or quality healthcare service to all the citizens of the country. That is why it is public healthcare service, because it is for all, it is for everyone, each and every individual of the country. Now, how they could provide a quality healthcare service, we will know that. So, health depends on basic amenities. Basic amenities like sanitation, nutrition, housing, proper environment, and it is the responsibility or duty of the government to provide us the basic amenities. So it is important to work on both healthcare and basic amenities. Now let us look at the following examples. Examples of Kerala and Costa Rican. Okay. So Kerala, they had made certain changes in the year 1996 in order to solve their situation or their problems. What are the changes? Number one, 40% of entire state budget was given to panchayat so that the panchayat could develop the village areas. Village was also given full freedom or autonomy to do planning for water, food, women and education. This all lead to a drastic change and improvement in the situation of Kerala. In this way, the government of Kerala had solved the problem of the people. The Costa Rican approach now. Where is Costa Rican? Costa Rican is a place in Central America. You can just look into the picture, okay? So, North America, the topmost part is the North America, then comes the Central America, then the South America. So in Central America, there is a place, Costa Rican. There, according to the Costa Rican constitution, they decided not to have army. So they used to save the money that the army would have used. Costa Rican government spent or utilize this money on health, education and other basic needs of the people. Basic amenities are provided to all Costa Rican due to this policy of government. In this way, Costa Rican government had changed the scenario of that particular country, and it is also considered as one of the healthiest country in Central America. So that's all. I hope you have enjoyed my today's session. But before signing it, let's do a quick recap of what we have covered up in this particular session. So we had started with a question. Is adequate healthcare available to all? The answer is a big no. In India, private sector services and government sector services both are increasing, but there is a basic difference, and the difference is the quality. Government hospitals are not able to provide the quality of treatment private hospitals are providing, but the cost of private hospitals are more expensive than the government hospitals, and even private hospitals are located in urban areas. Why? Because their main motive is to earn more and more profit. Due to this, many poor people can't afford and they have to borrow money from others. Private service also sometimes they encounter incorrect practices, like they prescribe expensive medicine, injections or saline even when it is not necessary. Healthcare and equality. Is adequate healthcare available to all? So the fact and figure shows us a different perspective. Only 20% of the population can afford the medicines that they require during an illness. 40% of people who are admitted to the hospital have to borrow money or sell their belongings in order to pay their expense. Then many times women health is neglected. Problems in tribal areas like few health centers, and there are also not any kind of private health services. So the tribal areas people suffered a lot. What can be done? Health situation of our country is not good, but it is the sole responsibility or duty of the government to provide quality healthcare facilities to each and every individual of our nation. Health depends on basic amenities like nutrition, sanitation, education facilities, housing and so on. It is important to work on both healthcare and basic amenities for our government, because government should provide it to us. Now in Kerala experience, we had known that they had made some certain changes in this state, like 40% of entire state budget was given to panchayat so that panchayat could do development in village areas. Village are also given freedom to do planning for water, food, women development and so on. This had improved their situation. Costa Rican approach. This Costa Rican is a place in Central America which is also regarded as one of the healthiest country of Central America. Under Costa Rican constitution, they had decided not to keep army. With the money of army's expense, they had utilized it in health, education and other sector of their country in order to provide basic facilities to the people. They also provide basic amenities to the people of their country. In this way, this policy of government had changed the whole perspective or scenario of that particular region. So, thank you and please write the question answers. Monday we have a holiday, so there will be no class. See you next week. That is on Wednesday. Thank you all.